Welcome back to the show, everyone. So we're going to do a Q&A episode today, which I feel like I haven't done in a little while. Um, and these are two questions I get asked really, really often. So they don't come from any one person in particular, but many of you. So I figured I would hop on the podcast to do an episode to cover the answers to this. The first question is calcium in a blood test a good measurement of bone health? A lot of the times I hear people say, I keep getting stress fractures or I got a bone injury, but my calcium levels are fine. I got my inside tracker test back, or I went to the doctor and I got my calcium labs drawn, and we've all heard like calcium, good for bones, and like they're normal. So what's the deal, with my bones breaking? So I want to cover this question first, and then the second kind of like question, but not really a question, is what labs do I recommend runners check on periodically? So these two really go together. So we're going to do them together. Um, so first off, calcium, when we take this blood test, serum levels basically measure how much calcium is in the blood. It does not measure how much calcium is in your bones. I repeat, it does not measure how much calcium is in your bones, and your blood calcium levels they're just not a good indicator of your bone health. They're just not. So the reason for this is because calcium is an electrolyte. The mineral, it's an electrolyte. That basically means that it helps to have normal calcium amounts in the blood so that your muscles and your heart is a muscle, that's one of them, can contract properly. So your body is always working really, really hard to achieve homeostasis. It's working really, really hard to keep calcium levels in the blood as normal as possible, because if they are not normal, there is a chance you are having like heart palpitation issues or irregular heartbeat, and it becomes more of an emergent situation. So typically if we're seeing like abnormal calcium levels, you're typically in the hospital already, because you had symptoms that brought you there. That's not always the case. I have had clients over the years who are going about their day perfectly healthy, and we get, a weird calcium lab back. But this really doesn't have much to do with bone health necessarily. It's not a good indicator of your bone health status. As a dietitian, now I will assess people's calcium intake along with a lot of other things that have to do with bone health when we go over what they eat in a day and their typical food recalls and their typical food intake. And that will kind of help me assess bone status a little bit more, in addition to several other things that I'm looking at, such as your overall calorie intake, your overall carbohydrate intake. These are really, really important for bone health. Underfueling is a really big instigator for stress injuries in the bones, and for full fractures too in the bones. So that's probably like one of the most important things, combined with, is your training program appropriate, or is it, working you way too hard, or, overloading you way too quickly? That's also another way people can get bone injuries. If there's chronic stress, for a variety of reasons, from a variety of places, this can also stress out the bones if the recovery is not appropriate. I also want to look at things like vitamin D, and also like looking at DEXA scans to measure bone density. These are really the things that are going to be the most indicative of your bone health, not your calcium levels. So like, is there a blood test that will tell me how my bones are doing? Vitamin D can be indicative of how your bones are doing, but it's definitely a lot more complex than that. We really want to look at your overall energy intake, your training plan, how you're recovering. Are you getting a regular period? That's super important for bone health for menstruating athletes. And so on and so forth. So if we see low levels of calcium in the blood, if you got a blood test back and you're like, oh man, like my calcium levels aren't normal, not necessarily indicative of bone health, but this could mean that there's some parathyroid hormone issues. It could mean that there's a vitamin D deficiency issue. There could be impaired kidney function. It could be because of certain medications. And typically your symptoms are going to be things like muscle cramps, dry skin, poor nail and hair health. You might have some numbness and tingling, abnormal heart rhythms. There's typically obvious symptoms when you come up with a low calcium level. When we look at a high calcium level, This can be because of vitamin D toxicity. So if you're taking way too much vitamin D, or if there's other more scary types of things going on, this could be involved with parathyroid hormone issues as well. Typically, hyperparathyroidism is a condition where we may see higher levels of calcium in the blood. It could be because of dehydration. Your electrolytes are just more concentrated in your blood because you aren't getting in enough fluids. It could also be because of medications as well, can cause high levels of calcium in the blood. And typically your symptoms are pretty similar as low calcium levels in the blood, at least as far as I am concerned as a dietitian. So that's a little bit on that. Hopefully that's helpful. So what's better for bone health? Measuring vitamin D levels in the blood. We really want that to be like above 50 for most athletes. And that is a higher reference range than sedentary population typical reference ranges. It's usually around 30 or higher. So we do associate, for female athletes in particular, 50 or higher is associated with a decreased risk of like bone injuries. Vitamin D does a lot more stuff too that I won't get into here, but it is super important to have adequate vitamin D levels. And that is a blood test that you can do and should be doing regularly. DEXA scans. This is a bone density scan. So if you really want to look at how your bones are doing, DEXA scan is probably going to be the gold standard. Now, not everyone's going to, but if you do ask for one, you may find it's relatively not super complicated to go get one. I have heard that from clients and friends and others that sometimes doctors are just like, no, we're not going to give you one because you're not over 65. Or you don't have broken bones right now. And it can be a little bit more tricky to persuade them. If you want one, you should be able to get one. You should be able to advocate for yourself to ask for one. If you really want one and you're really having a hard time, you can typically pay for them cash and they're relatively affordable. It's not like an MRI or anything like that. I've gotten one before for $50. So it's definitely something that you can go seek out from like a cash pay imaging service. Sometimes gyms have them because they're also body composition machines. Depending on what data you want, it might depend on where you go, but DEXA scans are bone density scans. You're going to get a score and it's going to tell you how your bones are doing density wise. If you do have low bone density, you may be diagnosed with osteopenia or osteoporosis, depending on where your ranges are. And that is definitely something that is, going to lead to bone health issues. Now, I've also had plenty of clients get stress fractures and bone injuries and not have bone density issues. Their bone density is fine, but maybe they're still not eating enough, or their vitamin D is low, or their training schedule wasn't appropriate, or they're trying to do a lot and they have a lot going on in their life and it was just too stressful on the body and the bone broke. Or they were wearing the wrong shoes. But a lot of the times nutrition is a factor with bone issues and definitely bone density issues. But that's a really complicated topic. And I do have an episode on bone health already that you can scroll back and listen to. So hopefully that answers that question. The next question, what lab should runners get? So obviously it depends. And with my clients, I'm able to customize to this to them a little bit more. Excuse me, because I do not think that we need to check all of these things every single time necessarily, but I do think it's really helpful to check all of these things at least once a year. And many of these things probably every 3 to 6 months. So, maybe 2, maybe 3 times per year, depending on where things are at. If you get levels back that are abnormal and you're trying to do interventions to improve them, you probably want to test more often. To see if your interventions are working, or if you have symptoms, if they're, improving or not improving. You probably want to test more like every 3 months, but you probably, want to test all of these things at least once a year. If there's issues with the rate with your levels, then probably want to retest them every 3 to 6 months. And I'd say most of these things should be tested every 3 to 6 months for runners, especially if you're like entering a training cycle in the fall. And then you do your race, and then you're also entering another training cycle in the spring, and then you do your race. We probably want to have some blood work baseline before the training cycle starts, and then maybe at some point like halfway through, especially if it's a marathon or more than a marathon. So here's the laps. Here's the list. I'll pause, So you can write this down. um, vitamin D, already covered that. Vitamin B12. This is really going to be indicative of like red blood cell health. Ferritin. You've heard me talk about ferritin before. Iron storage protein. That's what ferritin is. Iron, which is different than ferritin. We also want to test iron. A complete blood count, or a CBC. This is a panel that measures a lot of stuff that I won't get into, but this is also going to help us assess your red blood cell health and anemia risk and white blood cell health, how your immune system's doing. So that's super important. A complete metabolic panel, or a CMP. This is going to test things like kidney function, liver function, fasting glucose, and a lot more as well. Red blood cell magnesium. I like testing red blood cell magnesium more than serum magnesium, although if I can get both, I will. But red blood cell magnesium is a storage form of magnesium, and magnesium is kind of like calcium, where your body is typically trying to keep it at good levels in the blood. And I don't think I mentioned this before. If you're not getting in enough calcium or you're not getting in enough magnesium, the way your body keeps it normal in the blood is by pulling it from your bones. So I don't think I said that before about the calcium question. So that's why for magnesium, I like red blood cell magnesium because it is a storage form, and it tells us a little bit more potentially about your stores and therefore maybe if you're getting enough. Lipids. So your cholesterol panel, HDL, LDL, total cholesterol. Usually they'll give you a ratio and then maybe a non-HDL cholesterol as well. This helps measure our cardiovascular risk and also our metabolic function. But cholesterol is very complex. I have a whole masterclass on cholesterol because of how complex it can be. It's really a messenger, so it's not necessarily the only thing we want to measure when it comes to looking at your heart health, if that makes sense. If you do have high cholesterol and or you'd have like a lot of significant cardiovascular history, I also recommend one, you maybe meet with a cardiologist, but two, if you're getting labs done, apolipoprotein A and apolipoprotein B can be helpful to test. I do not think every runner needs to test these, but if you've got that family history or you've got cholesterol tests come back elevated, these things can be really helpful to measure. ApoB in particular is going to measure like it's found on plaques in arteries. So if it's elevated, it means there's more plaques in arteries. So this can be really helpful to measure your total cardiovascular risk in conjunction with things like cholesterol and other stuff as well. Hemoglobin A1C. So your hemoglobin A1C is a average of what your fasting blood sugar has been for the past 3 months. It is a lot more helpful than just getting a fasting blood sugar. The fasting blood sugar comes with the metabolic panel part of this list, and it's not useless, but the A1C is really, really a lot more helpful. Especially in non-pregnant individuals, because your blood volume changes in pregnancy and this can get skewed. But hemoglobin A1C is really helpful to basically look at your diabetes risk. So we want that to stay steady Eddie. It's typically going to increase, especially as women go through like perimenopause. It can increase a little bit too in like the postpartum period with breastfeeding. If you've got family history of diabetes, obviously if you have diabetes or pre-diabetes, this is definitely something we want to be measuring every 3 to 6 months since it is an average of the past 3 months. So we want A1C. A thyroid panel. Again, I don't think we necessarily need to get a thyroid panel every 3 to 6 months, but at least once a year. And if things aren't normal, probably more often than that. And we don't just want TSH, which is thyroid stimulating hormone. We want a full thyroid panel at least once a year, especially if you've never had this tested before. I think it's really helpful to test TSH, T3, T4, TPO, thyroid antibodies. You can look up a thyroid panel online and ask for the specifics of it if you feel like you just want to list it out for your physician, but typically they should know that a full thyroid panel includes these things. And the reason we test for everything is because I've seen really often, a lot of the times PCPs will test for TSH as like a screen for thyroid health. And the reference range for TSH is huge. And you're going to typically have symptoms at a much smaller reference range if it's outside of that. But they can't medicate you until you are outside of, or do surgery or other interventions, medical interventions, until you are outside of the normal reference range. But we can definitely experience some symptoms if we're outside of a TSH of 1 to 2. 1 to 2 is typically optimal. Anything outside of that, you might have some symptoms. It might be something we want to look at. And this is why I see really, really often people will have normal TSHs because there's this giant reference range, but they have a ton of symptoms. And then we pull their actual thyroid hormones, which are made by the thyroid. TSH is not made by the thyroid. It stimulates the thyroid. And we see that their thyroid's actually not functioning great. So we want the full thyroid panel. With thyroid too, getting antibodies tested can test for autoimmune thyroid related conditions, which is helpful from a nutrition perspective and a health perspective as well. A sluggish or hypothyroid tends to be associated with like underfueling, overtraining. A lot of the times I see it secondary to those things. And once we implement good nutrition interventions and we're fueling adequately, we're doing off seasons and having an appropriate training schedule, thyroid fixes itself and we may or may not need medical interventions and you feel better and your hair doesn't fall out. Good stuff. I could probably do a whole program on thyroid health. So I'm really condensing it, but thyroid panel, full one, typically we want at least once a year. Folate is a good one to check. This is a B vitamin, and it can be helpful to check B12, folate, and ferritin because this will tell you if you have an anemia present, what nutrient it's related to, because sometimes this can get confusing if you don't have all of them. And also HSCRP. So C-reactive protein is a general like inflammatory marker that I think can be helpful. Whoops, my Siri thinks I'm talking to her because I said CRP. Anyway, C-reactive protein is a good thing to get tested because it is a general marker of inflammation. And in people who are training a lot, if this is creeping up and up and up and up, this can be indicative that, hey, we're doing too much and we need to scale it back. Or, hey, we're underfueled and we're inflamed. We're not recovering. We need to scale it back. It can also be indicative of autoimmune related conditions developing, which I, have come across in my practice as well. Infections and other stuff going on. So I like a CRP probably 1 to 2 times per year on most people who are athletes. And if it's abnormal, probably more frequently than that. That in conjunction with a creatine kinase can be helpful, because that also measures basically like muscle breakdown. And that can be helpful to see how you're recovering from a race, at least like 6 to 8 weeks after the race. Timing is important. So that's typically what I recommend. I'm going to list it again and not talk between them. So if you're writing it down, you can just write it down. Vitamin D, vitamin B12, ferritin, iron, complete blood count, CMP or complete metabolic panel, lipid panel, red blood cell magnesium, hemoglobin A1C, a full thyroid panel, folate, and HSCRP, maybe with creatine kinase as well. So that's the panel. Now, there's a lot of other things that we can also add on depending on what these labs say. For example, I may have clients test things like copper or red blood cell copper or ceruloplasmin or homocysteine. I may have them test sex hormones like estradiol and progesterone. I may have them test cortisol, but a lot of the times that's a bit more individualized. I don't necessarily think, or testosterone for men and women too, actually. But I don't necessarily think we always need to have these things tested. I think from a nutrition perspective and a whole body perspective, we can tell a lot by the ones that I listed. I've had people test for many other things too, to rule stuff out or to get proper diagnoses with their physicians, and worked with, multidisciplinary teams as well to see how we should test people. So I hope this was helpful. You can take this, write it down, bring it to your physician and say, hey, I'd like these things to get tested. Do know that when we are testing things preventatively, like in this kind of situation, it's not always covered by insurance. So getting an understanding on what it's going to cost you, I think is super important. And that being said, with my existing clients who are in my group and one-on-one types of programs, I can order blood work for some people and it can be a lot cheaper because we're not going through insurance. When you go directly to the lab, you can get a lot of these things you're on your own at like a Quest lab. That's also relatively inexpensive compared to if you go through insurance and it ends up not getting covered. Um, there's a lot of ways to get labs cash pay that are cheaper than if you go through insurance, it's not covered and then you're paying cash anyway, if that makes sense. A lot of the times, unfortunately, there is price gouging with labs. But I can get pretty much all of these things done for under $200 for most people. So it's pretty cost effective. Obviously not attainable for everyone. But if you are needing support with that, I can point you in the direction of the right resource, or help you potentially ourselves in practice at Hollyfield Nutrition. So if you are looking for support with your labs, you want to go over labs that you've already gotten, or you want to discuss things that are bothering you, maybe you're having some symptoms and you want to understand what labs might be helpful, you can consult with us at Hollyfield Nutrition, myself and Erica. Erica in particular has client availability right now this summer, and I'll leave more info on one-on-one coaching with us, whether it's like just a one-off consult to go over labs or a longer one-on-one coaching commitment in the show notes. Until next time, happy running.